Another class in circulatory disturbances. As I told you, circulation is full of essay questions. And shock, DIC. Sometimes we get questions like DIC, septic shock, which we are not able to write. So straight away go to the book, study septic shock and study DIC. They are difficult questions. When you by heart, you get not less than 80%. So definition of shock. What are all the various causes for shock? It is not only loss of blood. It can be because of cardiogenic shock, or it can be because of burns. It can be a septic shock. So what are all the different types of shock that are given, which ultimately decreases the effective circulating volume of blood? And what are all the stages? There will be a primary stage and then a reversible one. That is primary. And later on, it goes in for an irreversible shock. The patient develops multiple organ damage. So that will be important for us. And when it comes to shock, you people will have to mention the classification of shock, the neurogenic shock, etc. And then when it comes to septic shock, there is again a flow diagram. Anaphylotoxins, etc. are being released, particularly in gram-negative bacteria, that you people will have to know. The pathogenesis will be there, and the stages, non-progressive and then progressive. Finally, it becomes an irreversible shock that you people will have to read up. And what are all the various organs that can be affected in a case of shock? The organ changes in a case of shock. For example, acute tubular necrosis occurs in the kidney. So similarly, what are the various organs which can be affected? You people will have to mention. Shock lung. It's a question for us. DIC is another one. It is a nightmare. A flow diagram is essential. I have covered it in my class in hematology also. So a flow diagram will be essential. And what are all the various factors that are causing DIC? In my notes in hematology, I have covered what are all the major things. For example, it can be any obstetric one, or major surgery, or it can be septicemia, like that. And it is also called as consumption coagulopathy. What is the pathogenesis? And ultimately, what is the method of diagnosing? So, the fibrin degradation product, etc. DIC, kindly read up. What can be the investigation? That brings us to the end of circulatory disturbances. This is a wonderful chapter where you people can score marks. Thank you.